What is chemo brain? Chemo brain is difficult to define. It's a term that's usually used by cancer patients, not by oncologists, the doctors who treat cancer. And it seems to be maybe a set of symptoms to do with thinking and memory, so like cognitive ability, like your mental ability. And as the name suggests, it's certainly connected with chemotherapy, but it may also be something that comes from other cancer treatments or even just other aspects of having cancer. Chemotherapy affects your nervous system, and in theory, it doesn't really get into your brain because of the blood-brain barrier, which I think kind of protects your brain mainly from blood-borne diseases. However, I have certainly experienced a lot of chemo brain during chemotherapy treatment and after chemotherapy treatment. And I've spoken to hundreds of cancer patients over the years about chemo brain. And I've heard maybe thousands of cancer patients talk about chemo brain. It's something that's not really discussed a lot by doctors, by sort of cancer doctors, oncologists, because it's difficult. And in the medical world, difficult things are not discussed. They're kind of a taboo. So I'll try and describe my experiences with chemo brain, and I'll share some of my thoughts about what chemo brain really is. So chemo brain is sometimes described as like a mental fog, and that's been certainly part of my experience. So when I've been undergoing chemotherapy treatment, and kind of for weeks after each treatment, my thinking will be unclear. I feel I'm thinking very slowly, and especially making decisions and taking action becomes a very slow process. You also tend to forget things, and yeah, it's like this combination of various aspects of your thinking slow down. Thinking becomes kind of difficult and a long process, and you become very unproductive. Now, I should say that chemo brain is poorly understood what it really is, because in all probability it's a whole bunch of things happening, not just chemotherapy related. As cancer patients, we often have other treatments. Many of us have had some big surgeries, and I think that surgery is very it's more traumatic maybe than the medical world understands. So you may have long-lasting effects from the surgery. We often have chemotherapy alongside molecular targeted therapy, and sometimes with radiotherapy as well. And then there are aspects of cancer that may cause mental issues. The fact that we're fighting for our lives that's a stressful, heavy thing. We're often very tired, tired in the sense of standard physical tiredness, but also the chemotherapy-induced fatigue. And that's a very challenging thing, because chemotherapy-induced fatigue is not relieved by rest. So usually when you're tired or exhausted, you have a rest and you feel hopefully a bit better. and maybe with a good rest or even a holiday, you could feel yourself again. But with chemotherapy, it's not the case. So yeah, chemo brain is very, very real. It's very poorly understood. You'll sometimes see in medical literature things like mental effects of chemotherapy tend to stop several months after treatment finishes. Of course, for some of us, treatment doesn't finish, it's an ongoing thing. And there also seem to be really quite a few cases where treatment finished for a patient and the patient fortunately went on to live a very long time, but the chemo brain continued for a long, long time. I've looked into chemo brain a lot in kind of the medical literature. There's not much there about it. This really is a poorly researched thing, I guess, because it's difficult to define. There may be a bunch of patients all suffering from something we call chemo brain, where some they may have similar issues, but for some of them it could be the stress of being diagnosed with cancer, the trauma of surgery, just the sheer exhaustion of it all. And others it may be the chemo attacking their nervous system. So it's a difficult thing to get your head around, but it's a very, very important thing that cancer patients, I think we all need to keep reminding our oncologists about this, because it has a very big impact on our life, and hopefully people will become a bit more serious about chemo brain in the future, looking into the nature of it, the causes of it, and how it can be prevented, and how it can be alleviated, I guess, as well. Please share your questions, comments, experiences of chemo brain, or anything else you'd like to know. Please do comment. It makes it much easier for me to do useful videos for you. Okay, thanks for your time.